Thank you very much for inviting me to speak to you today. I'm very sorry I can't be with you in person, but I wish you every success with your important workshop. Let me start by just briefly referring to this quote from Laudato Si by Pope Francis in 2015, which makes the case that we need a much more expansive conversation to include a whole range of different stakeholders to address the burgeoning environmental challenges that are affecting the whole planet, and to understand better how we are contributing. In fact, we're the major drivers of those environmental challenges that are affecting the planet, and of course threaten to undermine the progress in health and human progress that we've witnessed, particularly in recent decades. In 2015 also, the Rockefeller Lancet Commission that I had the honor to chair issued its report, which summarized the evidence about the environmental changes occurring and the potential implications for human health, but importantly also outlined some of the potential solutions that might help us to adapt to the change that we can't prevent, but also to minimize and reduce the change in order to support the world's population in coming decades and to sustain the progress in health and development that we have experienced as a species. These dramatic changes have led to the use of the term Anthropocene epoch to represent the fact that these changes are dominated and driven by our own species. So the next slide really summarizes what some have called the Great Acceleration. The Great Acceleration is where the pace of change has stepped up and has become really tangible and able to be perceived really by anyone who's objectively looking at the data. And you can see on the left side of the slide that there have been dramatic changes in gross domestic product, in human health, reductions in absolute poverty. We've seen declines in infant and child mortality, dramatic declines, about 75% over the last 5 decades or so. Improvements in maternal mortality. Life expectancy has gone up by about 25 years or so, global life expectancy average, since the middle of the last century. And of course, in order to achieve those advances, we've exploited much of the planet's surface, so we've transformed much of the land into agricultural land to grow the food that's necessary to support this growing world population. We've exploited much of the finite fresh water availability around the world, and we've also essentially exploited up to its maximum or even overexploited about 90% of our fisheries. So we're reaching really the limits of what we can comfortably and sustainably exploit. And on the right side, you can see that the impacts on the Earth system, so the accumulation of greenhouse gases, particularly carbon dioxide, long-lived greenhouse gas, methane, which is shorter lived, about 12 years in the atmosphere. You see that our oceans are becoming more acid as the carbon dioxide dissolves in the oceans. And we've reached the limits probably of much of the usable land that can be transformed to grow food. And we're seeing deforestation, of course, particularly in tropical regions, occurring at a dramatic rate, which is partly and largely responsible for much of the biodiversity loss that we're seeing, which is 100-fold greater than pre-human times. So all of these changes have led to the use of the term Anthropocene epoch that was first coined by Paul Crutzen in 2000 to describe these dramatic changes that are occurring as a result of the activities of humanity. So this also led to the concept of planetary boundaries articulated by Will Stephan, Johan Rockström and others. And this is a diagram taken from their 2015 paper, which they outlined 9 potential boundaries, within which, if we could stay within which we could actually flourish, humanity could continue to flourish. But the danger is, of course, that we're pushing at the limits of those boundaries, and we've already probably burst beyond them in the case of biosphere integrity, in the case of biogeochemical flows like nitrogen and phosphorus, which are causing widespread pollution in many aquatic and sometimes terrestrial ecosystems. Climate change, we're reaching the danger zone. Climatologists tell us we should stay within 2 degrees warming global average by the end of the century. And on current trajectories, we're going to exceed that, sadly. And for some of the others, like novel entities, like chemical pollutants and others, we don't really know exactly where the boundary exists, and there may not be a single boundary. So this slide shows us two climate futures. The red line is the future which we continue emitting greenhouse gases at business as usual rates, and that takes us to a warming level. Probably we shouldn't use the term warming, because that implies something rather comforting, but global heating, I would say, to 4 degrees by the end of the century. If we could really rapidly ramp back our greenhouse gas emissions, we could still stay within 2 degrees, which is the bottom line. 4 degrees or 2 degrees is just a global average. So that means that over the oceans, it's cooler, of course, over the lands, it's quite a lot hotter. So parts of the world could warm 5, 6, 7 degrees if we have a 4-degree average heating. Where are we now? Well, we're somewhere between those two, about 3.2 degrees, if the commitments made in Paris are actually honoured. And we don't, of course, know whether those commitments will be honoured. So it looks like, at the moment anyway, we're headed beyond the 2-degree threshold that climatologists tell us we should stay within in order to reduce the risk of serious adverse consequences like the collapse of ice caps and so on. So what are the emissions projections? Here are the most recent ones, the 2018 projections, and you can see that a couple of years ago it looked like emissions were plateauing, but in fact now they've increased over the last couple of years. They've increased. Historically, of course, it's been the US and the EU that have contributed most to emissions, but now emerging economies, obviously China's plateaued off as well in recent years. India's coming up, and of course in future Africa will contribute more from a low base. But you can see that we're still increasing overall our global emissions of greenhouse gases. Of course, urbanization is important because most populations, or the majority of the world, is now living in urban centers. And you can see how urbanization has taken place historically. United States, for example, urbanization started in earnest, I would say, in the 1800s. In Japan, there was very rapid urbanization in the 20th century. India is somewhat behind the curve, so still about 1/3 of the population is urbanized, but urbanization is occurring rapidly. You can see on the world, on a global level, over 50% of people now living in urban centers. So essentially, the future of planetary health, this interaction between environmental change and human health, will really depend on policies enacted in cities. Cities are the engines of economic activity, responsible for the bulk of global economic activity and about 3/4 of the global energy-related greenhouse gas emissions. The top of the slide is a tale of two cities. On the left is Atlanta in Georgia. You can see it's the home of about 5 million, just over 5 million people. And on the right you can see Barcelona, similar population, but a much smaller surface area. So Atlanta's a sprawling city, and Barcelona's a very compact city with an area of about 650 square kilometers, something of that order. And that has dramatic impacts on the per capita greenhouse gas emissions from transport, which are about 5 or so times greater in Atlanta than Barcelona. And that, of course, is because if you live in Atlanta, you're much more dependent on your private car. It's much more difficult to use public transport, walking and cycling. Of course, the Mayor of Atlanta is trying to rectify those issues, but it's intrinsically more difficult to create a sustainable transport system in a very sprawling city than a very condensed city. And the bottom part of the slide shows you the relationship between transport and urban density. And you can see that there's quite a strong relationship with Hong Kong being a very dense city with relatively low transport-related, at least, environmental footprint. So where we can design new cities, where they're being built in places like Africa, for example, or rapidly expanded in the case of India, then we need to think about those considerations from the outset. In the case of existing cities, the challenge really is to decarbonize them and to retrofit them for the Anthropocene epoch. This slide just shows you the per capita emissions from 13,000 cities from a very recent paper by Merant and colleagues in the Environmental Research Letters. And you can see that many of those are clustered in Europe, in North America, and to some extent also in Southeast Asia as well, and including Japan, of course, and China, Korea. So the challenge in these cities is to decarbonize them. The challenge in the emerging cities is to prevent them becoming carbon-dense urban locations from the outset, as far as that's possible. And you can see that the urban clusters with the largest total footprints, top 20 in this slide, have a large carbon footprint due to a combination of population and high carbon footprint per capita, which is shown by the bubble size. So you can see many of the European, US cities, of course, have large carbon footprints per capita, but these are the top 20, if you like, of the cities with their carbon footprints. So you can see for these cities in particular, there's quite a way to go in terms of decarbonising them. And of course, climate change is also related to some of the environmental impacts that we're witnessing today. I mean, climate change is having an effect on health today, and these effects and risks will increase over time. But air pollution, of course, is having very, very major effects on health today, and indeed it's one of the most important environmental risk factor. And a number of people have said that air pollution and climate are the two sides of the same coin, because the majority of air pollutants impact the climate directly or indirectly, and the majority of greenhouse gas sources co-emit air pollutants or contribute at least to their formation. So this multiplies the costs and risks, but it also provides an opportunity to amplify the benefits. So in decarbonising the economy, we can also achieve air pollution benefits. Ambient air pollution kills about 4 million people per year, premature deaths, according to WHO and other estimates, but new estimates suggest an even larger impact and larger effects on health. If you take into account the data coming out of China, for example, then the new estimates published last year by Rick Burnett and colleagues suggest that the ambient air pollution toll, the burden on deaths, could be approaching 9 million annual premature deaths. This slide shows you the relationship between PM, which is the most important fine particulate matter, most important air pollution, obviously not the only one. Tropospheric ozone is also important, and NO2 as well is of emerging importance. So this slide shows you the relationship between the per capita GDP and the PM levels. And you can see that there is a relationship, but some cities with relatively low per capita GDP also have quite low levels of air pollution, like Punta Arenas, for example. Others very high in GDP, like in some of the Gulf states, for example, also have quite high levels of air pollution. So there's no absolute relationship, but there is a general relationship between air pollution and development. But there's no absolute reason why a city, as it emerges from a low middle-income city to a higher income city, couldn't do so along a low air pollution, low greenhouse gas trajectory. And so even wealthy cities do have unacceptably high levels of air pollution, because we know that even at low levels, air pollution can be hazardous to health. Going back to climate change itself, this is from the recent IPCC 1.5 degrees report, and it shows you how rising temperatures are associated with rising risks across these different levels of impacts. Ecosystems, coastal flooding as the oceans expand and the ice caps melt, crop yields can decline, coral reefs can die off, and they're important host for fish populations for many parts of the world, and heat-related mortality and morbidity will increase, including, by the way, the effect of heat on labour capacity. So as you increasingly heat tropical and subtropical regions, it becomes more and more difficult to work outdoors. So this slide just summarises the impacts of climate change on human health, and I don't have time to go into detail. There are whole conferences now on climate change and human health. So this is just the headline impacts. You can see that climate change can affect health through direct and indirect mechanisms, through increasing heat, increasing exposure to extreme events, sea level rise, and of course indirect mechanisms as well. So it can affect a range of infectious diseases like vector-borne diseases, dengue, for example, common vectors of dengue, change their distribution, increase in allergen exposure in many parts of the world, changing levels of pollutants. As I've said, many of these are co-emitted with greenhouse gases. The direct effects of heat on mortality, and labour productivity, and the effects, of course, on undernutrition, very important effects of decreased crop yields in tropical and subtropical regions in particular. And then the potential effects of climate and other environmental changes on forced migration, possibly civil conflict, and according to the World Bank, also pushing perhaps 100 million people, extra people, back into poverty over the next decade or so. Just this slide just summarizes the largest heat wave that we've ever observed, well, the most impactful one at least, the European heat wave of 2003, which is a very, very rare event on a historical basis, probably one in a 120-year event, but will increasingly become the norm as we move towards the middle of the century. It killed about 70,000 people in Europe, about 15,000 in France, particularly older people, but not just older people, but those who were socially isolated, often in unair-conditioned accommodation, people living in apartment blocks and so on, where they couldn't get adequate ventilation, and people also dying in care homes that didn't have adequate ventilation and air conditioning. And there are ways in which we can adapt to heat, like air conditioning, for example, but these have their own downsides because you need fossil fuels, in many cases, to power air conditions, and when you've got to put the heat somewhere, so it goes out into the open air and increases the urban heat island effect. The urban heat island effect is shown in this slide on the right. You can see a sketch of the urban heat island profile. We know that cities radiate heat during the night and therefore are hotter than the surrounding rural areas, and we can reduce the urban heat island effect to some extent by planting trees, having open water, lakes and so on. Water courses in cities can help to reduce that urban heat island effect. The left side of the slide shows you how two different climate trajectories could affect heat loading over cities by mid-century. That's the top. The low emissions and the high emissions, and you can see that by the late century these two trajectories separate dramatically, so that at the bottom you can see the low emission trajectory, much lower temperature loading over cities, and the top part of the slide at 2100 you can see the high emission trajectory, and you can see that some cities might have a temperature increase, like Madrid, for example, which is shown in that slide, of perhaps up to 7 degrees, something like that, with a high emission scenario. So the two emissions really separate, trajectories separate after mid-century. But it's not just temperature, of course, it's also rainfall. You can see how storms themselves, the rainfall associated with storms, these heavy precipitation events are likely to increase with climate change. And you can see the dramatic record-breaking rainfall with Hurricane Harvey. So although it's quite difficult to attribute a single storm event to climate change, what you can say is that rainfall with these storm events is likely to increase. And indeed, the numbers of extremely intense storms is likely to increase as the temperature warms. And this will pose, of course, threats of urban flooding to cities, which have dramatic effects on health, of course, including increased mental health impacts several months or a year after flooding. It's not just excessive rainfall, it's also drought. And drought can be due to climate change, but it can also be due to overexploitation of finite freshwater aquifers, which can't necessarily be replenished in human lifespan. So this slide shows you where countries are over exploiting their aquifers. So in the Arab world, for example, the per capita availability of fresh water has declined by about 75%, something like that, since the last century, since around the middle of the last century. And increasingly countries are looking to desalinate seawater, but that itself has big environmental effects and large economic costs. So let me move towards the solutions. How do we develop sustainable and healthy cities? And this is SDG, Sustainable Development Goal 11, about making cities and human settlements inclusive, safe, resilient and sustainable. And in brief, I think there are three interlinked challenges: increasing the resilience to the environmental change that we can't prevent, reducing the environmental footprint of cities, and of course linked to that is promoting and protecting health in the Anthropocene. So what can we do to adapt to climate change? There are many things that can be done. One example, of course, is heat early warning systems. This is an illustration from Ahmedabad in India, a very severe heat wave in 2010. So what they've done is to implement a heat early warning system which identifies the temperature thresholds above which harms increase dramatically, forecasts the likelihood of crossing those thresholds, issues warnings based on risk assessments, and then implements interventions to keep people cooler, rehydrated, and cooler in their homes. And you can see in the bottom part of the slide the difference between the death rates pre the heat wave early warning system and post. And you can see that there did appear to be a big pre-post difference. So there did appear to be a benefit of introducing the heat wave early warning systems. But of course there are limits to adaptation. There are physiological, there are behavioral and technological limits to adaptation. And the danger is that we exceed these in times to come. We can also, to some extent, adapt to floods as well. And this is just one example. There's a lot of interest now in nature-based solutions, how restoring ecosystems can play an essential role in helping us to adapt to environmental change. This is the example of fresh water. So, for example, ecosystem restoration can improve the availability of fresh water. Wetlands can, mangroves can improve the resistance to coastal flooding. And on the right side of the slide, you see the urban centres that are likely to be experience coastal flooding with climate change over the next century or so. So these kind of nature-based solutions can be beneficial, but you have to design them carefully, because wetlands, for example, can also be hosts to populations of disease-carrying mosquitoes. So you need to think about minimizing the adverse effects on health when designing and implementing these nature-based solutions. We also know that decarbonizing the energy supply can have dramatically beneficial effects on health. A recent paper that we published a few weeks ago showed that if you could decarbonize the world economy, remove all the fossil fuel sources of energy through transition to clean renewables, then we could prevent about 3.5 million premature deaths a year, something of that order, from air pollution. And much of that, because urban air pollution would also be benefit from that. And if we could take out all the human-related sources of ambient air pollution, including household burning and also agricultural, then it would be 5.5 million. In addition to that, of course, if you take out household sources of pollution, you also benefit from reduced household air pollution, and that kills an additional, maybe 3 million, something of that order. There's a bit of crossover between the two. So big health benefits from moving towards a zero carbon economy. We also know there's big benefits from sustainable mobility trends, like public transport systems, car-free zones, reducing dependence on the private car, increasing walkability, for example, or bus rapid transit systems, car sharing, bike sharing schemes, low emission zones, and a whole range of different innovations in sustainable mobility that can reduce air pollution, reduce greenhouse gas emissions, and also improve physical activity. We know that sedentary lifestyle is a major killer, probably about 5 million deaths a year, something of that order. And this is a bit of a modelling exercise we did a few years ago for London, showing what would happen if you could get people in London walking and cycling like you do in Copenhagen. And we showed that there could be big net benefits from reduced sedentarism, particularly if you can get middle-aged and older people walking and cycling. There can be some downsides. You can see that the red at the bottom, increased road traffic crashes, but that's pretty minimal compared with the benefits, which vastly outweigh the risks. And of course you can reduce those risks by separating cycling from cars, for example, by reducing speed limits and putting in a whole range of different safety measures. But you can see the potential benefits for a whole range of common conditions. And those can be phased in, those benefits come in over time. For example, cancer obviously takes a lot longer time to be experienced than something like heart disease, which can, those benefits come in quite quickly. People often ask, can air pollution exposure negate the benefits of cycling and physical activity? And this is a nice paper by Tainio and colleagues in 2016. And what they show, that blue line shows you the benefits, so the reductions in risk. And you can see that for a heavily polluted city, 50 micrograms PM level, it's quite heavily polluted, heavier than European and US cities. You can see it's still beneficial to cycle, but there is a tipping point once you get to about 90 minutes or so of cycling, then some of the adverse effects of increasingly inhaling the particulates. But the break-even point is about 300 minutes per day. So it's still, you could do a lot of physical activity before you increase your risks overall. And in less polluted cities, of course, you can cycle and walk for much longer periods. So in practice, for most cities, cycling and walking is a good solution. And of course, you get more people out of their cars, that will reduce pollution. There's also evidence about obesity. This is a study done by colleagues here at the London School from a big study, UK Biobank, 500,000 volunteers. This is kind of a sub-study of people where they had commuting data. And you can see that the people who cycle or cycle and walk to work have a much lower percentage body fat than those that depend only on their cars. And there's a kind of dose-response relationship between how much you use your car and how much you walk and cycle. Your body fat declines the more you walk and cycle. An interesting observational study which suggests that obesity could be addressed through better walking and cycling. And then this is about walkability in cities, taken from a big study in Canada. And the bottom line is the most walkable quintile of the urban population, of the urban setting. And they adjusted for all sorts of confounding factors and found that the likelihood of the risk of diabetes was much lower, and also was declining faster in these more walkable neighbourhoods. Because if you have walkability, then people will walk to undertake their daily tasks that are illustrated on the right side of the slide. And increasingly, of course, there are apps available which would allow us to walk and to some extent cycle in cities, avoiding the most polluted streets and taking the most pleasurable routes that would expose us to green space and so on. And this is an example of a well-being walk in London, which aims to improve our well-being as well as helping us to get from A to B as most efficiently as possible. And then, of course, we know that green space exposure helps to improve physical health, but also mental health. This is a meta-analysis done a few years ago, showing that there are beneficial effects of exposing populations to green space in cities, which can include our mental health. So displeasurable moods, the vertical line is zero effect. Displeasurable moods are reduced, and pleasurable moods are increased by exposure to green space. Obviously, it depends on the quality of the green space and whether you can use it or not and so on. But there's also evidence around physical health. A recent study from Canada, a big study of the 2001 census cohort, showed that there was a relationship between proximity to greenness and mortality, particularly from cardiovascular and respiratory disease. There seemed to be increased protection for those of higher income and higher education, possibly because of increased use, increased quality of space, perhaps linked to higher income and education. So obviously more work to be done to ensure that we don't inadvertently increase inequities, but growing evidence around green space and health benefits. Growing work also around housing, very, very briefly. This is some work we did a few years ago in the UK, looking at the benefits of low carbon and energy efficient housing. The thermal imaging camera shows you where the heat's coming out of the house, the unmodernised house. The house next to it has been modernised, so it's much more efficient. And we showed that there could be big benefits from reduced cold. But there is a caveat to that. If you just seal up houses, you can get increased air pollution. So you also need to accompany the insulation and the sealing up with energy efficient air, ventilation and heat recovery. So you can save a lot of greenhouse gas emissions, some millions of tons at the bottom there, and a lot of premature deaths averted with adequate retrofitting. In low-income settings as well, don't have time to go into details, but big benefits for human health. Reduced indoor air pollution from clean cooking, solar lamps, better water, access to clean water and sanitation, and also resilience as well, as you can see in these houses from Bangladesh. And you can also design houses with reduced ingress of mosquitoes, disease-carrying mosquitoes that carry dengue and malaria, for example. So with good design, you can improve health and resilience of housing and also make them energy efficient. And then finally, the food system. The food system, of course, is a major driver of environmental degradation. About 30% of greenhouse gas emissions, about 30% of agricultural land is used to grow food, which is never actually consumed. And of course, many crops are used also to generate biofuels rather than being used for, or fed to animals rather than being fed directly to humans. So we and others have shown that by promoting healthy, more environmentally sustainable diets, you could get reductions in greenhouse gas emissions, land use, and water use. So this is just a kind of experiment. We did a modelling exercise. We did what would happen if we could transform the diets of the UK population this is taken from a systematic review, which shows that if you could adhere to healthy diets, then you get about 12% reduction in greenhouse gases. And if we extrapolate that to the UK population, then we'd also get big health benefits as well, probably about 8 months increased life expectancy and probably even slightly more greenhouse gas emission reductions, probably about 17%. Bigger benefits from vegetarian diets, but obviously more difficult to scale up those for kind of cultural reasons. And then finally, a lot of interest in innovations in the food system, new technologies, like sustainable aquaculture, like mycoproteins, use of insects for foods, novel foods, meat substitutes and so on, and of course synthetic meat as well, essentially grown on dishes in labs. At the moment, we still don't fully know the environmental footprints of these different options. There's a lot of work going on to determine those. But there's a lot of interest in nature-based city solutions like kind of urban farming, aquaponics, a whole range of different kind of social and technological experiments that are summarized here, some of the cities that are engaging some of these small-level experiments, and those are being evaluated at the moment. Whether they will make a large-scale impact on the environmental footprint of the food system, we don't yet know, but there's certainly a lot of interest in those kind of innovations at the city level, combining sustainable nutrition, low environmental impacts, and job creation. And of course, a number of cities now are ramping up their level of ambition. This is just the London Mayor's strategy, which aims to be carbon neutral by 2050, zero waste, so seeing waste as a resource, moving towards a circular economy, climate resilient, reducing flooding and so on, reducing noise with tranquil spaces, 50% green, planting more trees, for example, and aiming to improve air quality to be one of the cleanest air in the world. This final slide reminds us of the need for urgent action. If you look at the second row of semicircles, 2 degrees, you can see that if we want to have a 50% probability of staying below 2 degrees global average temperature increase by the end of the century, we have less than 30 years of our current emissions left. So that implies that we really need to cut emissions very urgently indeed, building on the aspirations of the Paris Treaty. And if you look at the 1.5 degrees target, you can see that we only have less than 10 years of emissions left. So unfortunately, it looks like the 1.5 degree target is really out of reach, unless somehow we can decarbonize, draw and suck CO2 out of the atmosphere. But we don't have the technology to do that in an economic and effective way at present. So what that means is that we have to keep the pressure up to work towards rapid decarbonization as soon as possible. And in doing so, of course, the policies enacted in cities will be absolutely crucial towards driving us to a sustainable economy in the Anthropocene epoch. So I wish you every success with this important workshop and with your deliberations. Thank you very much.
Thank you.